Oropharyngeal suctioning. The purpose of oral suctioning is to maintain a patent airway and improve oxygenation by removing mucous secretions and foreign materials such as vomit or gastric secretions from the mouth and throat. Nasopharyngeal suctioning removes secretions from the nasal cavity, pharynx, and throat by inserting a flexible soft suction catheter through the nares. So before we proceed to the procedure, we will assemble the equipments needed. This is a suction kit, kidney basin for the secretion, normal saline solution, and tubing. Of course, our suction machine or suction wall unit. Okay, so let's start. Let's begin to check the patient's medical record. Okay. So, private room 2, Mrs. A.V. Damian, 32 years old. Presence of rattling sound in tube or airway. Increased respiratory rate caused by difficulty in breathing. Decreased oxygen saturation, 85%. So, this indicates the need of oropharyngeal and nasopharyngeal suctioning. So, for this procedure, we'll be using a French 12 suction catheter because our patient is an adult. So, there's no sign of breathing disorder, laryngospasm, and epiglottitis. So, let's check our patient. Good morning, ma'am. I am Mika, your nurse for today. May I know your name and your birth date? Okay, let me check your identification band. Okay, so Mrs. A.V., are you still experiencing difficulty in breathing? Okay, so let me check your breathing sound and breathing pattern. Inhale. Exhale. Okay, so there's a presence of gurgling sound in your airway. Then let's check your oxygen saturation. Okay, oxygen saturation is 85%. So, today we will be doing or you'll be having a procedure which is called nasopharyngeal and oropharyngeal suctioning. So, you will aspirate secretions using a catheter or a suction catheter that is connected here in our suction wall unit. So, this will prevent plug or blockage into your airway which causes you to have difficulty in breathing. So, this procedure, ma'am, will not hurt you or harm you. So, don't you worry. And I hope you'll be giving your full cooperation during our procedure. So, do you have any questions regarding our procedure? Okay, so let me excuse myself for a moment. So, I can do a hand washing to prevent the transmission of microorganisms which can infect you. Okay, thank you, ma'am. So, ma'am, I'm done washing my hands and I've already closed the doors to provide you privacy. So, before the procedure, I want you to have a comfortable position. So, are you comfortable with your position now? Okay, good. So, I'll just prepare the equipments needed. Prepare the equipment by connecting the end of the tubing to the suction machine. Turn the suction device on and set the pressure to the lowest level possible that will effectively clear secretions. Then place the open-ended tube near the patient. Prepare the suction catheter by opening the suction kit. If drape is available, place it on the chest of the patient. Open the normal saline solution and fill the tray compartment with about 100 ml of this. Then, open the water-soluble lubricant and squeeze onto the catheter package. Be careful not to touch the package. Then, let's apply the gloves. Let's open the packaging. So, we will apply sterile gloves to our dominant hand. And a clean gloves to our non-dominant hand. Then, let us open our suction catheter. Okay. Then after that, we will attach it to the tubing. To make sure that it works properly, suction a small amount of saline solution. Okay. So it works properly. And then lubricate 3.2 to 4 inch of distal end of the catheter. Okay. So as I will go ahead and suction the secretions inside your lungs. As I insert this catheter, please inhale deeply. Okay. Nasopharyngeal suctioning insertion depth for adult is about 16 cm or 6.4 inches. Apply continuous suction by placing non-dominant hand on the vent of the catheter to 15 seconds at the same time. Then, slowly withdraw the catheter as you roll it back and forth. Okay, so try to cough and then expectorate your secretions inside the kidney basin. While rinsing the catheter, assess for the need to repeat the suctioning procedure. Watch for the alterations in the patient's cardiopulmonary status. Okay, let's do it again. Allow sufficient time between each suction for breathing and ventilation. Limit suctioning to 5 minutes in total. So, I guess we're done. Try to cough and expectorate your secretion inside the kidney basin. Rinse catheter and tubing by suctioning saline solution until catheter and tubing is cleared of secretions. Detach catheter from connecting tubing. Then, roll the catheter to the gloves. And after that, let's remove
or gloves. Then don't forget to turn off the suction device.
So, are you done with the kidney basin, ma'am? Okay. So, after the procedure, we need to facilitate or give an oral hygiene to the patient. So, assume that we already done oral hygiene. Next, we will position our patient to the comfortable position. So, ma'am, again, I will assist you. You can lay down and have a comfortable position. So, are you comfortable with your position now? Okay, good. So, let me assess your beating sound and beating pattern. Inhale. Okay, so the gurgling sound in your airway is already disappeared. And let's check your oxygen saturation. Okay, so I want to ask you if this procedure improves your breathing pattern, or is this procedure decreases your difficulty in breathing? Okay, good. So, I think we're done with this procedure. And I hope that this procedure helps you. So, if you have any questions and if you need something, you can call me in the nurse's ward. So, may I excuse myself first so I can document our procedure for today. Thank you. So, after the procedure, we need to do hand hygiene. So, assume that I've already done hand hygiene. Let's go for the documentation. Okay. Decreased difficulty of breathing, no gurgling sound, normal skin color, oxygen saturation 85%, now 98%. So we need to document the color, the amount, odor, and consistency of the secretion, size of the catheter, French 12, patient's response to the procedure. So the procedure starts at 8:20 a.m. and done at 8:30 a.m. The date for today, October 28, 2021. Okay. So, we're done for the Oropharyngeal and Nasopharyngeal suction.
Oxygenation. This treatment increases the amount of oxygen your lungs receive and deliver to your blood. Oxygen therapy may be prescribed for you when you have a condition that causes your blood oxygen levels to be too low. Low blood oxygen may make you feel short of breath, tired, or confused, and can damage your body.
So, before the procedure, we'll be assembling and gather the equipments needed. So, here are the equipments needed. Anisa cannula or cannulae, face pen, unbreathable mask, micropore or tape, then of course, oxygen supply, oxygen supply, flow meter, humidifier, and that's all. So, first, let us check the patient's record. So, private room 4, Mrs. Amelie Bautista, 26 years old. Presence or positive in difficulty of breathing. Oxygen saturation is 85%. Okay, doctor's order administer oxygen therapy using a nasal cannula. This is the device we need to use. And the flow rate, which is 4 liters per minute. So, let's check for the patient. Good morning, ma'am. May I know your name and your birthday? Okay, let me check your identification band just to be sure. Okay. Ma'am Amelie, how are you feeling today? Are you still experiencing difficulty in breathing? Okay, so this time, I will give you a medication. I will administer an oxygen to you. This will help you in breathing and it will increase the amount of oxygen into your lungs. So, this will prevent you from experiencing difficulty in breathing and for the ease of your breathing pattern or breathing airway. So, is there any question? Okay, so before the procedure, may I excuse myself for a moment so I can do the hand hygiene to prevent the transmission of microorganisms. Okay, thank you, ma'am. Okay, so assume that I've already done hand hygiene and I've already closed the doors to provide privacy for the patient. So now, let's start the procedure. So, let's attach the flow meter to the tank. So, assume that I've already attached it. Okay. And then, attach the humidifier with distilled water at the base of the flow meter. Okay. So, assume that I've already attached it. Then, after that, you will attach the device, which is our nasal cannula. This one. Open it. And then, let's turn on our oxygen supply with the prescribed weight, which is 4 liters per minute.
The purpose of nasal cannula is to deliver a relatively low concentration of oxygen when only minimal oxygen support is required, to allow uninterrupted delivery of oxygen while the client ingests food or fluids.
So, let's put the cannula over the fine space and this outlet prongs into the nearest of the patient. Then the tubing should be at the back of the ear of the patient. Then, adjust the strap under the tube.
Assist the patient regularly.
Also,
Assess
we can
patient's
use
vital
a pad.
signs, level of
We can pad the
anxiety,
tubing and the
color, and ease
cannula over the
respirations
ears
and provide support while the client adjusts
and
to the
cheekbone
device.
if only needed.
Assess the patient in 15 to 30 minutes, depending on the patient's condition, and regularly thereafter. Assess the patient regularly for clinical signs of hypoxia, tachycardia, confusion, dyspnea, restlessness, and cyanosis.
Then, next is the face mask. So, let's remove the cannula and let's try the unbreathable mask.
The purpose of the face mask is to provide moderate oxygen support and a higher concentration of oxygen and humidity.
So, we will put it or attach it at the oxygen supply. So, we will apply it from the nose downward. Okay. And then you will secure the elastic band around the client's head. Okay. So, after that, I will show you how to wear a face tent.
The purpose of face tent is to provide high humidity, to provide oxygen when a mask is poorly tolerated, and to provide a high flow of oxygen when attached to a ventures system.
Okay, so let's remove the unbreathable mask. Remove the tubing that is attached to the oxygen supply. Then, let's put the face tent. First, of course, you will attach this device into the oxygen supply. Okay, place the tent over the client's face and secure the ties. Oh my god. And secure the ties around the head. Okay, so for the face mask or the face tent, we will inspect the facial skin frequently for dampness, chafing, and keep the skin dry. Okay, so let's remove this face tent. And let's put again the nasal cannula or nasal cannulate. So let's attach this to the oxygen supply. Okay. The same procedure. Okay, then adjust. Okay, so for the nasal cannula, we need to assess the client's nares for incrustations and for irritation. And then, of course, you will assess the top of the client's ears over here for any signs of irritation from the cannula strap. Okay, so we need to inspect the equipment in a regular basis. So let's leave this equipment here so the client can breathe normally or is in breathing. So after this procedure or after our procedure, we will document the findings in the client's record. But after that, we'll be needing to do hand hygiene to avoid or prevent the transmission of microorganisms. So let's go. So assume that I'm done washing my hands. So now we are ready for the documentation. So for the documentation of this procedure, which is the oxygen therapy or the oxygenation, there is a form or checklist that is supplemented by a narrative forms. So let's start documenting. So the device that is used for this is a nasal cannula, a face tent, and an unbreathable mask with a flow rate of 4 liters per minute. So the procedure starts at 9:30 a.m. October 28, 2020. Okay, so we're done for the oxygenation or the oxygen therapy.
Incentive is spirometry. It is also referred as sustained maximal inspiration device. It facilitates a sustained slow deep breath. It is designed to mimic natural sighing by encouraging patient to take slow deep breaths.
Good morning, ma'am. I am Nurse Mika, your nurse attendant for today. May I know your name and place of birth, ma'am? Okay, so how are you feeling for today, ma'am? Okay, good. So today you're going to have an incentive spirometry test, which improve your lung function and lower your chance of developing infection. So this procedure will not harm you, so don't you worry. I hope that you will give your full cooperation during our procedure, and I hope that you will listen to my instruction. So, is that clear? Is there any questions regarding this procedure? Okay, so let me excuse myself first. I'm just gonna do the hand hygiene and I will prepare the equipment needed for this procedure. Okay, thank you, ma'am. Okay, so assume that I've already do the hand hygiene and I've already closed the doors to provide privacy for the patient. So, these are the equipments needed. This is an spirometry device. Okay. And this is my DIY spirometry device. Dummy. Okay. To show how to what do you call this? How to insert the mouthpiece inside your mouth. Okay. And then this one is a kidney basin for the patient when the patient will expectorate the secretion. So let's begin the procedure. So ma'am, let's exercise the slow and deep breathing. Inhale, exhale, inhale, exhale, inhale, exhale. Okay, good. So let's start. You just hold this spirometer and then you will seal the mouthpiece. Seal your lips around the mouthpiece. Okay. So before that, you will exhale deeply and slowly. Okay. Exhale. Then, okay, let's put inside your mouth. Inhale. Hold it for 2 to 6 seconds. Okay, good. And then, let's remove it. Exhale. Okay. So, try to cough in our kidney basin. Okay. Expectorate your mucus or your phlegm inside this kidney basin. So, deep ventilation will loosen your secretion, and coughing will allow the secretions to be expectorate or be removed inside your lungs. Okay? So, again, let's try for the second time. Exhale normally. Okay, let's insert. Inhale. Hold for 2 to 6 seconds. Exhale. And try to cough. Okay. So, let's show it using our tongue. Okay. So, we will seal the mouthpiece inside the lips, around the lips, I should say, like that. Okay. Inhale for and hold 2 to 6 seconds. Then remove, then exhale. Okay. So, wait lang. So, we're done with this procedure, which is the incentive spirometry test. Ma'am, do you feel an improvement in your breathing pattern? Okay, good. Okay. Okay, so let's have an oral hygiene. Okay, so let's assume that oral hygiene is already done. Then, ma'am, our procedure is done. If you have, or if you need something, or you have questions, you can just call me in the nurse's ward. So, let me excuse myself so I can document this procedure. And thank you for the cooperation. Okay, so before the documentation, we will do a hand hygiene to avoid or prevent the transmission of microorganisms. So, assume that I've already done hand hygiene. So, let us document the procedure. So, we use a flow-oriented device, and then the response of the patient to the procedure. So, there is an improvement in the breathing pattern of the patient. So, the procedure starts at 10 o'clock a.m. and done at 10:15 a.m. Date for today is October 28, 2021. So, we're done with the incentive spirometry test. Thank you.